for Justice Group. Her husband Gareth died from the virus in March 2021.
We're pleased that the inquiry is finally getting underway. After a 2-year fight, people really need to know that this hasn't been a natural process where the government have agreed to an inquiry willingly. It has been a 2-year fight to get this from the Justice Group. And we were optimistic. I met with the Baroness, as did many bereaved people all over the UK, earlier this year. I was 5 feet away from her, had a picture of my husband, and she told us at that point there would be a listening exercise. And obviously we were pleased about that. As things have transpired, the listening exercise, which is where the views of the bereaved will be listened to, it looks like it's going to be a parallel thing that's going on. In other words, it won't be part of the inquiry. Our views will be listened to by a third party, and they will summarise what we say, and then that will be fed into the inquiry, but it won't be used as evidence, which makes us feel as though we will be marginalised.
Well, Professor Sir John Bell is someone we often turn to during the pandemic. He was a member of the COVID vaccine task force, and he will be contributing to the inquiry. Good afternoon, Sir John.
Yeah, good afternoon, sir.
What's the most important thing for you that the inquiry can establish?
Well, I think the crucial question is, what can we learn from what's happened over the past 2 years that could be applied sensibly so that when we get caught by another pandemic, which we surely will, we're as prepared as we possibly can be to deal with that. And that, I think, is the most important learning that we can get from this.
Right. And that, so in one sense, we should be able to get to that fairly early on because that's the starting point.
Yes, it is. But remember that this pandemic, judgments about how well this pandemic has been going or not going have changed over time. So countries that looked like they had it all squared around ended up a year later looking like they were in trouble. A strategy at the beginning wasn't necessarily the right strategy at the middle or the end. So it's a dynamic, these pandemics are dynamic. You're talking about a living virus and an immune system which is changing. So it's more complicated than saying tick, they got it right, and X, they got it wrong.
Although when you look at the UK, we did have a very high death toll compared with many other countries, didn't we?
Well, you then get into a discussion about how you measure deaths and whether these are excess deaths or others. As you know, those numbers were reevaluated over time, and it looked like we were an outlier, but it turned out that we weren't. So I don't think I would rely on that as being the right way to necessarily adjudicate how well we did.
Right. So how would you adjudicate how well we did?
Well, I think that's really up to the inquiry, and I don't want to preempt that discussion. I think it's probably the right thing for the inquirers to look at this step by step, which is what they're doing, which is, I think, the appropriate way to look at it. Look at how we prepared ourselves before there was a pandemic and compare that to other countries. Look to see how the response went in the first weeks and months. Look at how decisions were made and the like. So, I mean, that's really the plan for the inquiry, and I think that's the right thing to do. It's very difficult to take a holistic view because, with the exception of the Nordic countries where they did pretty well, there isn't anybody who did really well from beginning to end of this pandemic.
Now, I mean, we're looking at the moment where people are talking about another wave coming in the winter, and obviously, because of vaccines, the things have changed. How seriously we're all affected by it, and the COVID itself has changed. But it makes me wonder, given what you're saying, the most important thing is preparedness for another. Are we ready for another now?
I think we've still got more work to do to get ourselves ready for the next assault. I'm hoping that we're going to get a bit of time to get ourselves organized, because what we have done is we've learned a lot about how we can prepare ourselves better to have testing ready to go, to have vaccines which are at least partly developed so we can launch those into action, perhaps to have antivirals. So there's a lot of things that we can do to put into place. It would be wrong for me to say that I think they're all in place now, but we have learned a lot of things from the last couple of years.
And you have previously said that you hope the effect of the pandemic would be to push the UK to treat health security more akin to national security. Has that happened?
So we have the new Health Security Agency. I think we need to see how well it gets resourced over the next few years and decades. I think it is fair to say that we went into the last pandemic with a less than properly supported public health system to manage these things. And as a result, we ran into some bumpy, choppy water early on. But we learned a lot about what we needed to do. And a lot of those learnings now are sitting in the Health Security Agency. So I'm hoping that we'll be able to resource it. Don't forget, and people are now talking about this more widely, but as you know, I've alluded to this many times for the past couple of years, that some of the really serious pathogens, like the avian flus, carry with them a mortality of 30%. The world really stops in the way we know it if you get a pandemic of that kind of pathogen, and that is not out of the question. So this is not trivial stuff around the edge. This is really core to national security.
You mean COVID was relatively mild in terms of what we could be facing?
Well, I don't want to say that because, of course, there are a lot of people who lost family members and so on in COVID, and those are tragedies. But if you just look at the absolute numbers in terms of case fatality, it is substantially less severe than you get with many of these others.
Professor Sir John Bell, thank you very much as ever. Well, let's turn to Ukraine, because over